someone wanted to know about the relationship of the torsion in patients who have skew deviation from abnormal otolith vestibular input at the level of the brainstem. So, as you know, when you tilt your head to one side or the other, you are activating your vestibular ocular reflex. You need that so that you have counter rolling to maintain the verticality of your visual environment. If you didn't have this vestibular ocular reflex, every time you tilted your head, the whole world would tilt with you. And we can't have that. So every time you tilt your head, there's compensatory movement of your eyes to maintain the vertical alignment in space. And so that's going to necessitate that you have bilateral torsion. So the torsion has to be bilateral. If only one eye were to tort, then you'll have subjective torsion. And so both eyes have to have a counter roll against the head rotation. And so when you have skew deviation, you have disruption of that input from one ear, but not the hearing part of the ear, the vestibular part of the ear. It's going to make your brain think that you need to have the counter rolling, and that is going to cause both a deviation of the eyes, a hypertropia, and bilateral torsion towards the hypotropic eye. So in your brainstem, your semicircular canals and your otolith complex talking to vestibular nuclei at the level of the eighth nerve, then that signal is sent rostrally to get the eyes to counter roll. So you've got your third and your fourth nerves to get the eyes to counter roll, to make the muscles that do both torsion and vertical movement fire so that you can get back into vertical alignment. But if the signal is faulty, then you'll be counter rolling against a false signal, and so you will make a counter roll motion and a head tilt called the ocular tilt reaction, which is pathologic because there actually is no signal, it's a faulty signal. So the faulty signal creates the false impression that you must compensate with a torsional movement of both eyes and a vertical movement, and that results in a pathologic ophthalmoplegia and ocular misalignment associated with a head tilt called skew and the ocular tilt reaction.